A 50-year-old woman has frequently burned herself while cooking over the past several months. Exam shows loss of pain and temperature sensation in both upper extremities and in a portion of her trunk from the clavicles to just below the nipples. Touch, vibratory sensation, and proprioception are normal. There is some wasting of the small muscles of her hands. Which of the following findings is most likely on MRI of the head and spine? Now, this patient is having loss of pain and temperature sensation in a cape-like distribution, and this is most consistent with Syringomyelia. Her touch, vibratory sensation, and proprioception are all normal. So Syringomyelia is going to affect the pain and temperature sensation because we're going to have a fluid-filled cyst that is going to be filled with CSF, and it is going to grow and compress the fibers of the spinothalamic tract. And proprioception and vibration are going to be intact because remember that those are going to be going up to our brain in this region. And remember that syringomyelia is going to be basically a cyst filled with CSF that is going to basically affect this portion of the spinal cord. So it is mainly going to compress the fibers of the spinothalamic tract. And this area is going to be basically intact. So we're still going to have vibration and proprioception intact as a result. Now, because the spinothalamic tract is bilateral, we're going to have a loss of pain and temperature on both sides of the body. And this is going to occur in a cape-like distribution. So the loss of pain and temperature sensation is going to be in these areas. So it is going to be a cape-like distribution. Now, the affected regions of the body is mainly going to be from C2 to T9. And most commonly, it is going to affect the cervical vertebrae. So the syrinx here we see is affecting the cervical vertebrae. And syringomyelia is going to be associated with Chiari type 1 and type 2 malformations. So in this image, we also see the cerebral tonsil protruding inferior to the foramen magnum, and this is consistent with Chiari type 1 malformation. If we go back to the answer choices, we see that answer choice D is answering our question. The patient has a syrinx of the central region of the spinal cord from C4 to T5.